Hey everyone. All right, so my name is Bailey. I'm the therapy coordinator with Westview and Tanglewood Pediatric Dentistry, and I'm just waiting for Jean to hop on real quick here, and we'll get right started. Hey
Okay.
Jean.
Hey.
All
Okay.
right, change my camera real quick. All right, so thanks for hopping on. Okay, so my name is Bailey. I'm the therapy coordinator for Westview and Tanglewood Pediatric Dentistry. So I work with a lot of patients who are getting ready to go forward with a frenectomy or are having concerns related to a tongue tie, lip tie. And then Jean is one of the speech therapists in our practice that sees patients through our Westview office on Wednesday mornings. So she is going to be kind of going through a lot of the big questions that we've gotten over the last couple weeks on tongue ties, how they can affect kids, and how they affect really, especially the small age kids, and how we collaboratively have this approach of getting them back to full function.
Thanks, Bailey. Yes, as she introduced, I'm Jean Hawney. I work at Westview Pediatric Dentistry and then also have my business, Little Eaters and Talkers, here in Houston. And I have an influx always of big babies and toddlers, under the age of 3 that are going through pre-frenectomy work and post-frenectomy. And there's so many questions to address. So we wanted to kind of help the public know that we are here to support you. We are a group of providers that want the best for your child, and it's never a one and done. And so we are here to answer a bunch of questions.
Yeah. So I know this one we're really diving deep more into tongue ties, the frenectomy process for that older baby, younger toddler age range. So the most common question that I think I get, and I can't speak 100% for you, is what is a tongue tie?
Okay, so what's interesting is as a speech pathologist, I'm always in people's mouths, as are other providers, whether it's your dentist, your ENT, whatsoever. And sometimes a new parent will be like, a tongue tie? I've never heard of that before. And
Hmm.
that's why it is important to address this question. So you might hear of it as tongue tie. That's the most common word that you'll hear. Also, ankyglossia. And
Hmm.
so this is when your tongue has limited movement, and it's kind of for some people it almost feels like the tongue is glued to the floor of the mouth. And what does that? It's a frenulum. We all have a frenulum, and we all just come in different shapes and sizes, our frenulums.
Hmm.
Sometimes it's abnormally short and it's attached too close to the tip of the tongue. And when a baby in utero is developing their tongue and their sucking habits, they have the frenulum. It's just that after birth, sometimes it remains attached. So if everyone just looks in their mouth or their children's mouth, you're going to see, for the most part, a little piece of string, yeah, right
Hmm.
under your tongue, and that is your frenulum. That does not mean you have a tongue tie, and we'll talk more about that.
Okay, good. What are there different types of tongue ties?
Okay, so this is a hot topic because you will hear varying opinions on this. And I do truly believe, coming from a medical background, that as research evolves, that people will start to evolve as well, right? Generally speaking, there are anterior tongue ties. That's the one that is the most noticeable because it comes to the tip of the tongue.
Hmm.
And then there are posterior tongue ties. Posterior tongue ties, again, that one you might hear from a provider that dismisses it and says it's no such thing, but you also might talk to someone that really does feel that that can be impacting your child's progress. The anterior tongue tie is usually super visible, that when you open your mouth, it's right there in your
Right.
face. With the posterior one, it's more difficult. Um, Sometimes there's webbing or tenting. Sometimes I'll notice even with the posterior pulling of the floor of the mouth, lots of straining in the muscles of the face and the head and the neck. But generally speaking, there's anterior and posterior is what you'll hear.
How do we know how bad or how severe a tongue tie is for a child?
So when I get my babies from a provider such as Dr. Gandhi, she has already done her assessment using the Kotlow or the Hazel Baker. And so she's kind of determined from her lens the severity, mild, moderate, severe. In some cases, not always with babies, you can't really measure, but in older adults and teenagers, you can actually measure the tongue range of motion
Mm-hmm.
from the bottom, from the floor of the mouth to the tip.
Mm-hmm.
Uh, Now, what is my role to also build onto the severity? I take the provider's scores that they've determined, like from the Kotlow,
Mm-hmm.
and then I place in my role of function. In addition to talking to a parent, what is going on? How is this tongue tie impacting this child's development? Or maybe it's not. And so we just have to look at the big picture to really figure out um, the overall severity.
Yeah. Another one that I got was, do tongue ties only affect babies? Because obviously for us, like Dr. and I started treating only babies, and then we kind of changed. So what in your scope do tongue ties only affect babies? What scope of tongue ties do you care for as far as ages?
So I see usually 0 to about 3. That's my focus. Um, Generally speaking, with the older kids, they'll go more towards myofunctional, like traditional myofunctional therapy, whether it's with a speech pathologist or a dental hygienist. And I'll talk more about that. But generally, yeah, not just a baby as a tongue tie. And a lot of times, I can't even tell you. I saw a baby last week where mom said, no, he was diagnosed as a baby with a tongue tie, and we just didn't feel like it was the time. Things were too stressful to do anything about it. But now we're still having trouble, and it's still in the back of my head that now my toddler is something's going wrong,
Mm-hmm.
something they're having difficulty because of this tongue tie. So, some babies do fine and they have a tongue tie learning how to breastfeed or bottle feed, and then it kind of pops up when they're transitioning to solids.
Yeah.
Sometimes it's like, okay, they're compensating, they're doing okay, and then we notice it with their speech or their breathing posture and patterns. And so I really love the increased awareness that's going on with parents acknowledging, like, wow, my baby is snoring. Why is my toddler snoring? I can hear them from the other side of the
Yeah.
house, and
Yeah.
acknowledging that that's not normal
Mm-hmm.
and it's not good for your health. Now,
No.
are all of those meaning that you have a tongue tie? Not necessarily, but it could be a piece to the puzzle to investigate. So, no, it does not just affect babies who are trying to breastfeed. And more research is coming out saying that it can affect other areas as well.
Yeah. I mean, I can speak on my own experience. I mean, my oldest was 14 months old. My youngest was 3 weeks old. And I was 30 when we had our procedures done.
Well, and actually, that brings up a good point about sometimes it runs in the family.
Oh, it most
There,
definitely does.
there
Yeah.
is a gene. And
Yeah.
a lot of times, even a parent will come in saying, something's not right. And I'll look at mom or I'll look at dad and I'm like, yeah, it runs in the family. But
Yeah.
not always, but sometimes it can.
Hmm. So obviously, not every child that you see is referred from our office. You have your own private practice. Of the babies that you see or the kids that you see, what is part of your kind of wheelhouse going where you're evaluating a child that would make you really recommend or encourage or reinforce a child's need for a frenectomy procedure?
So I think people ask me to build on this if tongue ties are overdiagnosed. Do you ever
Mm.
hear that one?
I have heard it. It's not a common thing that I hear with my role to practice.
Okay. I I get that question all the time. And I do say, yeah, sometimes it is, or it's mis it's misinformed. It's not
Okay.
appropriately diagnosed because so for a baby who's having trouble with bottle feeding, let's start there. I have to rule out this baby doesn't have bottle aversion. This baby doesn't have reflux.
Hmm.
This baby is using an appropriate bottle. So a lot of times there's some fixes that I can help you with bottle feeding or even breastfeeding, right?
Hmm.
Positioning that doesn't involve having to get a procedure. So I want to do everything that I can to maybe avoid the procedure if we don't feel like it's necessary,
Hmm.
right? So we
Yeah.
might start some therapy, kind of put those pieces to the puzzle together. And if we are like at a standstill or plateauing, then we're
Hmm.
going to probably kind of reconsider that tongue tie really causing some issues, even with my babies.
Hmm.
So if I have a baby who's 6, 7 months transitioning to solids, I'm not going to necessarily rush to a tongue tie procedure. We're going
Hmm.
to try learning how to eat. And then if we're continuing to have difficulty, whether it's gagging or texture preference or inability to move the tongue
Yeah.
laterally and up
Yeah.
and down, then we're going to proceed. With my toddlers, it might be, whether, the speech is a little difficult because they're toddlers. They're learning how to talk. So I'm not going to expect a toddler to be able to say all these sounds and these words, but I'm going to kind of pay attention to patterns.
Hmm.
Um, is it a language delay? Like if a toddler is not talking, that's not because of a tongue tie. And I will say that again. If your toddler is not talking or using sounds, that is not because of a tongue tie. Can a tongue tie possibly inhibit a bad formation of how you're going to produce a sound? Maybe, but when you're a toddler, I can't, I don't know that yet.
Hmm.
So something else is going on, and that often happens too, where I'll see that situation. Another one is like if you're exhibiting behaviors like drooling and open mouth posture and whatnot, we're going to try to strengthen those muscles first before determining if we need to get a release. And we
Hmm.
don't always, a lot of times, honestly, parents will tell me, my kid is doing so well with you in therapy. I don't think we need a release anymore. And we put it on the back
Yeah.
burner. And I'm like all for that, as long as we are making the progress that we want to make.
Right. Right. I know that's a huge reason why we kind of have this different approach than some providers might when it comes to the procedure itself. Like this is a functionally related procedure, not a we're just removing part of the body. This isn't like a tonsillectomy where we're just going in and removing the tonsils. This is more like an orthopedic procedure of we got to retrain the muscles, we got to retrain how we move so that we really get that full benefit. And if we can get that full benefit from just physical therapy, just like you would not get an orthopedic procedure,
Mm-hmm.
then we've got to have that same viewpoint for the frenectomy procedure too.
Yeah, no, that's a really good point and a really good analogy because so many people will say, I wish I didn't get that knee surgery, or I wish I didn't do that. I should have just done more physical therapy.
Yeah.
So that's actually like a really good, yeah. And I believe that too from this perspective.
So sticking on to doing the what we call pre-work, doing the physical therapy, doing the retraining of the muscle groups, why is it so important or so vital that a patient or a family is seeing you in conjunction to a tie release procedure?
Okay. So I really, and to build on that, the time that you need to see me pre-frenectomy, I don't know. I can't answer that question. Sometimes it's once or twice, and sometimes it's 4 times. It depends on the temperament of your child. It depends on how well you're going to carry over
Hmm.
the exercises that we are going to do. It depends on if you are coming to therapy, right? There are a lot of variables, and I am here. So are the body workers, whether it's
Hmm.
PT or chiro. We are here to help the provider know that this child is ready. This baby is ready. It can be harmful to the child and the parents if you rush. We do not want that to happen. I promise you, you will have way better outcomes if you work with someone pre-frenectomy. You're working on the active wound management. I'm training you
Hmm.
on that. I'm training you on getting into your baby's mouth so that they are prepared for that. We're making um, movements with our tongue really fun, and we are trying to reduce the anxiety. That's also the importance of the body worker, right? The nervous system. We
Right.
want that to be calm. I don't
Hmm.
want to go into this procedure super stressed and anxious. We need
Yeah.
to have the body as calm as possible. And I always use the analogy of like, before I'm going to go do a race, like if I'm going to run a marathon, you better believe I'm going to get a massage a couple of days before because
Hmm.
I need to relax my body. If I go into that race without being relaxed, I'm not going to have a good run. And so it's the same for our babies and our parents. So I
Yeah.
want people to be aware of like what the process is.
Hmm.
Even though the procedure itself is pretty quick and easy.
Oh yeah.
It takes like
Like
1 minute,
6 minutes, 5 minutes
if
in and
that.
out.
I
Total,
know
like start,
it's
finish.
so fast, but you're changing a part of the body
Yeah.
in that small amount of time. And so it is really important to see a provider before and then after. But the
Hmm.
amount of time is, it just depends. Every child is different and every parent is different.
Yeah. What do you see happens, or what physically happens with that release procedure and the change in the movement or the ability for movement?
Okay, so I really have to encourage parents. Every baby is different on this too. Recovery. That can
Hmm.
take a couple of days, it can take a couple of weeks. I've had some people say they noticed more improvements even a month after.
Hmm.
And so that really also varies. Um, Overall, the healing of the surgical site will take several weeks. The
Yeah.
soreness that
Yeah.
generally wears off after about a week or so.
Hmm.
The lip, that's a quickie. That's like
Yeah.
48 hours,
Yeah.
easy peasy. The tongue usually is pretty sore for a bit, for about a week or so. Um, but my goal is for my babies and toddlers to continue to work through the process and retrain the tongue, right? We want it to
Hmm.
rest in the proper position. We want to promote good swallow patterns. Um, with Dr. Gandhi, which I really appreciate, her rule before frenectomy is like, we can't be thumb sucking, we can't be finger sucking, we can't be on a pacifier. If you are a
Hmm.
toddler over the age of like 15 months or so, we should
Yeah.
not, we should be bottle weaning. And I am here to help you with that.
Yes. Yes.
And I have a lot of success with getting those habits weaned
Hmm.
and working with parents on that. It can happen. Um, and so, my goal is to help guide you through the pre and then the post. And the best part is post frenectomy, you're like, oh my God, we're not having to suck our thumb anymore because now our tongue is in the right
Yeah.
spot.
Yeah. I will say the amount that H8, my oldest, after her procedure, we had it done at 4 o'clock in the afternoon. She crashed as soon as we got in the car. We drove to dinner. We were having dinner with a friend. And I'm like, yeah, she'll be fine. We can go out for dinner. And took a nap for 45 minutes. This kid woke up and demanded to eat, and I've never seen her eat so much in my entire life to this date.
And
And she was
eat
14
well.
months old and ate well. Immediate, like for her, it was night and day the moment after the procedure.
And she continued that way.
Yeah. And she has never turned back.
And
Now,
and
now
that's
P was a little different. She's a little more sensitive.
well,
She's
and
a little
that's what I was
more, I'm
gonna
gonna do it
say.
my way.
Not everybody is gonna have that type of like wham bam,
Hmm.
thank you, ma'am. But
Right.
because and I can really I've been around so many kids that I could read the temperament of kids,
Oh yeah.
and honestly, boys sometimes are a little bit more fussier than girls, and they might, yeah, they're weenies. But in general, like they don't like pain. But
Hmm.
and this is in a lot of aspects of their life. So it's just a matter of like the healing process and
Hmm.
getting through being a little sore and how you can tolerate it
Yeah.
because everybody's tolerance is so different.
Yeah.
But I mean,
Yeah.
like your first girl was like, I'm ready.
Like eating pizza crust, eating tomatoes, eating ice cream, eating the pasta, eating full chicken, like off the bone. Like,
But if your child didn't do that,
yeah,
then I'm here to guide you so that we can do
exactly.
that, right?
Exactly.
Or if you were a parent that didn't give those foods before and you might be too scared to do it after, I am going to be here to help you do that.
To do the heavy hand holding, the light hand holding, the kind of here's the roadmap, here's what we
Exactly.
do,
This is
everything.
what we
Yeah.
want, you know? Now, there are times when, maybe a parent will tell me, I didn't get as much out of it as I wanted. Not necessarily parents that I worked with pre-frenectomy,
Hmm.
parents that come to me months later
Okay.
and they're like, my child is still having feeding
Yeah.
difficulties, right? And then I'm like, okay, well, is there something else going on?
Hmm.
Or was it really a tongue tie? Or was that just a part of the puzzle, but we didn't deal with the constipation? Or we didn't deal
Hmm.
with learning how to sit up and
Yeah.
crawl, or possibly the child is neurodivergent,
Hmm.
you know, and so they're going to have a different trajectory.
Yeah. So why would I decide as a parent to go ahead and have the procedure done?
Okay, so as we know, not everyone needs a tongue tie release.
Hmm.
Please don't. Not everyone does. Not everyone has a tongue tie. It is my job to help guide you through this process. As I mentioned, I have seen children that, you know, were kind of on the fence,
Hmm.
and then they progress in therapy and we decide they don't need to. Um, but ultimately, we want to make this decision based on multiple factors. The examiner, the provider's exam, the discussion with caregivers. Um, I really want to make sure that we're going to have success after this
Yeah.
tongue tie. So, back to your question was, why would I want my child to do this? I mean, our goal is that if you're breast or bottle feeding, we're going to do better at breast and bottle feeding.
Hmm.
We are going to have ideally better and healthier sleep habits, right? We all want better sleep. We want to avoid long term issues of how the palate develops, having enough space for our teeth, um, speech impairments, cavities, even. A lot of the
Hmm.
dentists will talk about that, especially even with the lip ties,
Yeah.
causing a lot of dental stuff.
Yeah.
Um, we really want to develop normal swallowing patterns, being
Hmm.
able to not be drooling, not tongue thrusting. And these are
Hmm.
all things that, you can Google or we can talk about it another time. Um, we want we want our babies when they get older to be able to do proper licking of things
Hmm.
and even kissing and sticking out your tongue and things like that
Yeah.
actually,
Matter.
ask around about that. Um, we also want to reduce, help desensitize our gag reflex.
Hmm.
This is a big one. If your tongue is always low, you're not stimulating the gag, and then
Hmm.
it becomes hypersensitive. So that's actually like a big red flag. Um, and then another one is when you're transitioning to solids, I want to make that easier as well,
Yeah.
transitioning to foods. So that would be like your big takeaway for my babies and toddlers of like, why do I want to do this?
Hmm. And then what can parents do if they're noticing these types of concerns, like especially seeing the tongue thrust past the age where it's considered normal, or seeing the oversensitive gag reflex, seeing this difficulty in the transitional phase of bottles to table food and solids. What can they do? What can we do to support that?
Okay, so number one, I don't generally recommend you rushing to go see a dentist or an ENT. I don't, because they're not going to be able to fix those problems.
Hmm.
So, and I don't want parents to do that as their first step. The first step is to find a feeding specialist that treats these. Okay, that person can help guide you in the direction that you need to go to. If the primary goal is breastfeeding, get a really good IBCLC, a lactation consultant. If it's bottle feeding, usually, find a feeding therapist that is a speech pathologist or an occupational therapist that does
Hmm.
infant feeding. SLPs and occupational therapists can assist with transition to solids. For toddlers and getting older, I do generally gravitate towards speech pathologists because then we can have the background of if they have a background of
Hmm.
myofunctional therapy. And the reason is because we can continue to assess the feeding, the swallowing, the oral motor, and the speech.
Hmm.
Now, something I touched upon earlier was that a lot of times around the age of 4 and up, more kids will start seeing registered dental hygienists, RDHs,
Hmm.
for the myofunctional therapy. And they do a phenomenal job. There's so many amazing RDHs out there. However, if your child in combination has a lot of speech issues and
Hmm.
feeding, then I would really strongly consider going the speech pathology route. If that's just trying to figure out which provider you need to,
Type. Right.
like,
Right.
where do I go?
Yeah.
And it's so confusing. It is craziness. Um, and then they can help guide you on to finding that provider that fits, kind of what you need.
Yeah. One thing I get, I wouldn't say often, but I've gotten at least, I would say at least 4 times every 6 months is, oh, well, I know that you said that feeding therapy or speech therapy might really benefit, but our pediatrician said that we don't need this. How do you combat the kind of idea of, oh, well, the pediatrician said one thing, they said that, we can kind of watch and wait, but I have this concern that I didn't really feel was addressed with a pediatrician. How do you kind of approach that while still respecting that scope of specialty that the pediatricians have within care?
So I usually ask on a scale of 0 to 10 how much this is affecting you or your baby, right? Let's get a rating of how this is bothering you. If this is causing more anxiety, then you should seek assistance. There's nothing wrong with trying to do what your gut tells you to do.
Yeah.
The cool part about what's happening now with concierge therapy is that you don't need your doctor's permission even really to like talk to me.
Yeah.
You can book a consultation with me. You can book a
Online.
30-minute consultation with me online. We could talk it out and I could be like, okay, I agree with your doctor, or you know what, let's just do a screener and then let's figure this out. Because honestly, most of the time, our doctors who are amazing, I work with some really great pediatricians, they're learning from their patients. When a mom comes in and says, so we ended up seeing that speech pathologist and we found out that, like, my baby really is having trouble with solids and she
Hmm.
helped me. And now we're eating everything.
Yeah.
I can't imagine how a pediatrician would say, I can't believe you did that, and judge a parent for doing something
Yeah.
that actually helped everybody.
Hmm.
So I get it all the time too. In my response to some of those parents that are on the fence, I'm like, after we talk about their rating of where they are, of how much it's affecting them,
Hmm.
and assuring them that early intervention is helpful.
Yeah.
Um, if we wait and see too long, it's the habits could get worse or they can get better.
Hmm.
So, give it a try. Do use Dr. Google, right? See what Dr. Google says. But if it's ultimately not working, then you need to get help.
Yeah. I really like that analogy of on a scale of 1 to 10, how much anxiety, how is this affecting the family unit? How is this affecting you as the parent? To really, I want to say like put in perspective, but like put a number on it.
Hmm.
That is such a great analogy of like having it visually even in your mind of how is this really affecting everyone? And is it affecting everyone enough that we need to do something about it?
A lot of times, unfortunately, but it is what it is. Moms will say, "Well, my husband thinks everything's fine. My pediatrician thinks everything's fine." I go, "Okay,
Hmm.
have your PD feed your baby." No, like bring your bottle to your next appointment and have your PD feed your baby. Show them how hard it is, right? And
Yeah.
then you expect mom to do this all day, every day. And it's resulting in tears or arguments. So,
Yeah.
but yeah, I mean, I always sound like if you are so confused, even just like more down the rabbit hole based on like how we talked even today, you can book a 30-minute consultation with me on my website, super easy. You can do a full evaluation at Westview Pediatric Dentistry.
Hmm.
You can message
Yeah.
you, go on your
Yeah.
website, give you a call. Like there are resources out there. Even on Facebook, there are some amazing mom groups that I belong to. And parents are always like, my, now use this with a grain of salt because sometimes I get really pissed off. Parents will say, "Oh, my 18-month-old is really not eating. All they want to do is breastfeed." And you have parents that say, "Okay, well, contact Jean or contact,
Hmm.
so and so."
Yeah.
And then you have a huge patient population that'll go, "It'll get better. Don't worry about it. Try this, try that." And that's just frustrating because then you're making someone feel like they're crazy,
Mhm.
right?
Yeah.
You're like, "I swear I'm crazy. Like my 18-month-old should not be breastfeeding this month, should be eating foods.
Hmm.
I need help with this." And
Yeah.
so getting help is better than being brushed off.
Hmm.
So, yes, I love my Facebook groups, but then sometimes they get me upset.
I
But
would
yeah,
much rather ask pick your brain any day than
then just play
the Facebook group.
it like it'll get better.
Yeah.
Because as we know, toddlers are feral and they don't always get better. They get
Hmm.
more set in their ways. And then
Yeah.
it can impact the family dynamic more.
So we've got options for overall big picture, small picture. Big picture, we can book an appointment with you through your website.
Hmm.
Uh, I know we've got you linked here. And then also, you are always more than welcome to reach out to me or anyone with our office with Westview and Tanglewood Pediatric Dentistry directly. Jean's at the office Wednesday mornings. And then I know small picture frenectomy wise, this was incredible as far as the information on how this really plays into really getting that function back and why your role within the overall care as a functional provider is so vital for our patients, especially that 6 to 18 month range.
Hmm.
In addition to the chiropractors or the physical therapist and occupational therapists that patients are seeing, this is why we have that functional approach is because we see it work time and time again. And I know that we could kind of sing that song until the cows come home. Um, but I really love that you took the time to kind of run through this with us. I
No,
appreciate it.
I love all this, and just to add to what you were saying, if you go to a provider and they don't recommend any pre or post work with someone else, run, because you want an optimal outcome. You're going through this with your baby. You want everything to work out for the best.
Yeah.
But thank you. This was really good. This was a good thing to talk about for a lot of
Yeah.
parents.
I'm glad we do this every month. Every the last Tuesday of the month at 8 o'clock Central. It's 7 o'clock my time being in Utah, but it's 8 o'clock Central for everyone else that's on. We hop on and and talk about a burning topic that either a lot of families are asking us or that we get repeat questions on, that our own patients submit their questions on through our stories or comments, and we really appreciate that as
Yep.
well. So we'll be back next month to talk about the next big
Cool.
topic. Awesome.
Thank you. Thanks,
Thanks, Jean.
everyone.
Bye,
Bye.
guys.